Hello, everyone. Welcome to tonight's webinar. My name is Arlene Walker, and I'll be your moderator for this evening's session. We'll be emailing you Dr. Meschino's presentation recording, and that'll be after the webinar. So you won't have to take notes because you'll be able to view the webinar again and watch the slides as they move across the screen. Also, we've set aside a half hour after the presentation for questions and answers, and you'll be typing your questions into the chat box at the bottom of the Zoom window. Sometimes you will find that questions you may have are answered as Dr. Meschino moves through the presentation. So I recommend that you make a note of your questions during the webinar and type any unanswered questions into the chat box at or near the end of the presentation. Before we begin, I'd like to tell you about our presenter, Dr. James Meschino. Dr. Meschino is the author and co-author of 4 nutrition, wellness, anti-aging books, including the Meschino Optimal Living Program, 7 Steps to a Healthy, Fit, Age-Resistant Body by Wiley Publishing. He's an associate professor in the Division of Physiology and Biochemistry at the Canadian Memorial Chiropractic College, where he's taught courses on nutrition and biochemistry since completing a master's degree in nutrition and biology in 1984. He's also taught nutritional medicine courses for the American Academy of Anti-Aging Medicine, the American Council on Exercise, and the Global Integrative Medicine Institute. Having published over 150 review papers on nutritional and lifestyle medicine, in the prevention and complementary management of common degenerative health conditions, Dr. Meschino has established himself as an expert on the evidence-based application of nutrition and lifestyle practices in disease prevention, management, and anti-aging. He's also taught numerous corporate wellness programs to Canadian and American companies and firms, and has appeared on many TV and radio shows, including his Detroit PBS special, Healthy Aging Naturally. And most recently, he's developed a leading-edge digital wellness coaching platform for employee group health benefit plans and related wellness programs. He's also the formulator of Adeeva nutritional supplement products sold in Canada and the US. On behalf of Adëeva Nutritionals, I want to thank everyone for attending this evening as Dr. Meschino presents this very timely research-based webinar on essential fatty acids in health and disease. Thank you very much, Dr. Meschino. I'll hand it over to you.
Thank you, Arlene. I appreciate that lovely introduction. Very much appreciated. And thanks everyone for joining this evening. This is, I think, a really important kind of webinar to sit in on, because a lot of things happen in the invisible world of the body that we don't really see from the outside. But behind the curtain, if you will, a lot of sort of little magic tricks are going on that either sort of move us towards degenerative diseases or help to slow down the rate at which certain degenerative diseases might manifest, and also slow down age-related changes, helping to increase our healthy life expectancy or the likelihood that we're going to have a highly functioning body and mind for the longest period of time. Essential fatty acids are an important part of the story. So I'm going to try to build that storyline for you this evening. This is a really fantastic little research review that was published in 2014. So if you're someone who's seriously interested in this subject as I go through it, this would be a fabulous research published paper that you might want to print off and read in its entirety if you really want to get into the weeds and dig down deep. So just a sort of a high-level overview. Most people have heard that our omega-6, omega-3 balance is out of whack, that we have too much omega-6, not enough omega-3. And so how did this come about? Well, through human evolution, our ancestors used to eat, when they ate animals, these were animals that were foraging for their food in the wild. And those animals, because they're foraging for their food and eating, different kinds of foods than our domesticated livestock would have today, we're producing more omega-3 fats. So our human ancestors were eating foods that had more omega-3 fats, and our bodies use those for health promotion purposes. In modern day society, with sort of the domestication of animals, feeding them more grains, not only is there more saturated fat in those foods, but the types of omega fats they make are more the omega-6 fats. And this comes with some consequences. So as you start to eat more foods that have a lot of omega-6 fats, they accumulate in your body, and your body cells will convert some of those omega-6 fats into a type of little mini hormone called prostaglandin number 2, or prostaglandin series 2. And it's prostaglandin series 2 exerts its influence on the cells in that community. It starts to produce some harmful health effects slowly over time. It tends to increase more inflammation, which can cause arthritic changes, damage our joint cartilage, and people end up with osteoarthritis. The omega-3 fats, or the omega-6 fats rather, also tend to encourage cells to divide at a faster rate. When cells divide faster, they make more genetic mistakes that can lead to cancer risk. And also the brain relies very heavily on omega-3 fats for a lot of reasons that we'll see down the road. So when you're depriving the brain of omega-3 fats and giving it more omega-6, then you tend to have greater tendency for things to happen in the brain. The brain ages faster, a greater risk of dementia, Alzheimer's disease, less able to recover from concussions and other problems. In the cardiovascular system, the prostaglandin series 2 made from omega-6 fats tends to cause our platelets to stick together a little bit more with a greater amount of propensity. Those abnormal clots can lead to stroke, heart disease, thromboembolism. It can constrict our blood vessels, increasing the risk of high blood pressure, as you'll see, and producing more blood vessel inflammation as well, which is linked to more heart attack risk. And even skin cells will take the omega-3 and omega-6 fats from the bloodstream below, and as the skin cells are developing, if there's a lot of omega-6 and the skin usually is drier and rougher and scalier than it really has to, in terms of smoothness and softness and moisture, the skin, it doesn't reach its full potential. And if you have a skin condition like eczema or psoriasis or acne, often it'll make it worse, as you'll see. So the omega-3 fats, if you can get them into your body, at higher levels, and sort of displace some of the omega-6 fats, it's very good news, because the omega-3 fats, the body converts into prostaglandin series 3. So the omega-6 fats become prostaglandin series 2, which work like little mini hormones in all the different areas of the body. The omega-3 fats become prostaglandin series 3, which have these really positive health effects. They decrease inflammation, helping to reduce joint inflammatory conditions and prevent them, slowing down the rate at which your cells divide, which is very strongly linked to the prevention of cancer and having greater longevity, as you'll see. In the brain loves omega-3 fats because those prostaglandins made from omega-3 reduce brain inflammation, open up the blood vessels so more blood can flow to the brain, and that's important to prevent dementia, vascular dementias. And also the brain fluidity, how well the brain cells move and can communicate with each other is much better with omega-3 fats as the primary fat within the brain cells. And the omega-3 fats tend to discourage the production of beta amyloid plaque. Beta amyloid plaque is what we see in Alzheimer's disease. And for people who've had concussions, we see that omega-3 fats can help to repair some of the brain damage and bring the person back, get their memory back, decrease the headaches. And in the cardiovascular system, the omega-3 fats with prostaglandin series 3 help to open up blood vessels, which helps to keep blood pressure low, and it reduces blood pressure or blood vessel inflammation, so you're at less risk for heart disease. Makes your platelets less sticky, so you don't have these abnormal clots leading to a sudden heart attack or a stroke or a deep vein thrombosis. And also the omega-3 fats strongly are associated with decreased arrhythmias and atrial fibrillation as people get older. It's a very common problem as people get older. If your omega-3 status is higher, the risk of that developing seems to be lower. I will show you this research. And in the skin, omega-3 fats have been shown to improve the smoothness and softness of the skin, but also to help in the complementary management of acne and eczema and psoriasis, 3 very common and troubling skin conditions. So I basically told you everything that you need to know. What I'm going to do for the rest of this webinar is actually give the scientific evidence that supports what I've just said. So I have to go through it fairly quickly. Some of it's a bit technical. We'll try not to get lost in the weeds of this. I want you to come away with a sort of an overview, but I'll feel that the information I'm giving you is credible and from credible sources. So that's what I'm going to be doing now. And we'll make sure that these slides are available to you. So if you want to go through them a little more slowly at your own pace, you'll have access to that. So we're going to look at how these omega-3 and omega-6 fats impact all these conditions and how the research really demonstrates how important getting that omega-3 to omega-6 balance really can be. And I'll show you how to do it in ways that I think are very practical. So the story really begins back in the 1970s when these two researchers, Bang and Dyerberg, maybe you were around back then, it was on the radio and TV, they sort of wrote this paper saying, hey, take a look at this. Greenland Eskimos, as they were called back in those days, you wouldn't call them Greenland Eskimos now, but that in the original paper, that's how the Inuit people were referred to. Back in the 1970s, the discovery was this population eating all this whale blubber and these high omega-3 fatty foods have much less cardiovascular disease, and their platelets don't clump together forming abnormal clots in their bloodstream the way that occurs in most Western societies. And I said, it looks like these omega-3 fats have something to do with it. And that was the beginning of sort of modern day omega-3 research. What we know today is that when it comes to food that you're eating, there's 4 types of fats that you can put into your body from food. So let's just get this high level overview. So there's saturated fats. The long chain saturated fats tend to raise cholesterol, promote inflammation. They increase the stickiness of your blood. So that's why eating high animal fat products like beef and pork and butter and cheese and whipped cream and ice cream and then pastries. This is why people get themselves into trouble when there's too many of these kinds of foods in their diet. Same with coconut oil and palm oil. And in the Indian cooking system, they use ghee, which is sort of a clear type of butter, but it's low to a saturated fat. Sometimes people deep fry things in coconut oil, or they're having butter or cream, and all this type of saturated fat content in the diet really increases the risk of cardiovascular disease quite significantly, as you likely know. Then there's the monounsaturated fats from like olive oil and olives and avocados and peanut oil, canola oil, eating nuts as well. And the monounsaturated fats are pretty good fats, actually. It's sort of beyond the topic of this discussion today. What I want to get into are the polyunsaturated fats. And the polyunsaturated fats in the diet come in 2 varieties. There's the omega-3 and the omega-6. And that's what we're going to be concentrating on in this presentation. And then, of course, there's trans fats. So you can take sunflower seed oil or safflower seed oil, and you can blow it full of hydrogens and make it partially hydrogenated. And you form these trans fats. So you get in shortenings and certain types of fatty materials that people use for deep frying. And these things also raise cholesterol and cause some harmful health effects, as you likely know. So a lot of governments now around the world have banned trans fats from things like peanut butter and some other foods because they raise cholesterol. They're strongly linked to cardiovascular disease in particular. But today we want to talk about omega-3 and omega-6. Just wanted you to see how it fit into the grand scheme of fatty acids. So let's talk about inflammation first. So to understand what really goes on, when you have foods that contain omega-6 or omega-3 fats, some of those fats don't just get used for energy, but some of the fats that you swallow of this nature become part of the outer skin of all the cells in your body. So all the cells in your body have this outer skin around them. And what's it made out of? Well, it's a really fatty, waxy material. Some of the fats that you eat get incorporated into that cell membrane, as it's called. And every 5 to 15 minutes of your life, the polyunsaturated fats, the omega-3 or the omega-6 fats that are in there, get converted into these prostaglandin hormones that I was talking about. So if you're making a lot of prostaglandin series 2 from omega-6 fats, that's problematic. If you're making prostaglandin series 3 because you have a lot of omega-3 fats in the cell membrane, then you're getting the health promoting effects. So the more omega-3 fats you have versus omega-6, the more you're going to make the types of mini hormones in the tissues that you have that are going to help to decrease risk of disease and promote longevity. So this looks complicated, but it's actually very simple. This is just showing that one of the main omega-6 fats is known as arachidonic acid. So where do we get arachidonic acid? High-fat meat products like beef, really, really high, but also egg yolks, chicken legs and chicken wings, veal, sausages, bacon, hot dogs, those kinds of foods are loaded with arachidonic acid, which is an omega-6 fat. And as omega-6 fat gets into the cell membrane of your cells, that arachidonic acid gets removed at some point and becomes prostaglandin series 2. So you see that this arrow is bringing it down, all the way down to prostaglandin series 2 and thromboxane A2, which makes your platelets very sticky. And in your white blood cells, the arachidonic acid becomes a very inflammatory chemical called leukotriene B4, makes your immune cells very inflammatory, which really speeds up arthritic changes in particular. So having a lot of arachidonic acid in your cell membrane is a very undesirable thing, because your body will convert that arachidonic acid into prostaglandin series 2 and produce all these adverse effects that you're seeing. Now, when you take an aspirin blocks this particular step here, this particular enzyme known as the cyclooxygenase enzyme. And that's how aspirin reduces inflammation. That's how ibuprofen and indomethacin and Voltaren. This is how all these non-steroidal anti-inflammatory drugs reduce inflammation, by blocking this step. But if you think about it, if you didn't have a lot of arachidonic acid in your cell membrane to begin with, then you wouldn't have so many inflammatory chemicals being secreted. You don't need that much aspirin or ibuprofen, anymore, because your body's not making the inflammatory chemicals that result from the arachidonic acid. So in the grand scheme of things, here you see arachidonic acid. And what I'm saying is that through that particular enzyme system, it becomes prostaglandin series 2. And in your white blood cells, it becomes the inflammatory leukotriene B4. Now, the omega-3 fats, so this is EPA, or eicosapentaenoic acid, that comes from fish and fish oil, as an example, using the same enzymes in the cell membrane, becomes anti-inflammatory prostaglandin series 3 and anti-inflammatory leukotriene series 5. So the omega-3 fats are anti-inflammatory, and the omega-6 fats, especially arachidonic acid, produce more inflammation. So now, if you just bear with me a little longer, you already know what's on this slide. Here's the arachidonic acid here. You know it forms prostaglandin series 2. You know it forms leukotriene B4. This shouldn't surprise you anymore. But what you want to notice is that you can ingest other omega-6 fats that can slowly become arachidonic acid. So when you over-ingest corn oil, sunflower seed oil, safflower seed oil, they have a lot of linoleic acid, or LA. And LA can slowly over time become arachidonic acid. It becomes a secondary source of it. Now, what's peculiar about this is that under the right circumstances, when you get down to this level, the DGLA, before it becomes arachidonic acid, it can make a left-hand turn and become prostaglandin series 1. So I told you that there's prostaglandin 2 and 3, but here's prostaglandin 1, and prostaglandin series 1 is actually a very anti-inflammatory prostaglandin. If you can make this conversion happen, that's spectacular. And the way that you do that is by giving your body the GLA that it needs, along with vitamins and minerals, to make this conversion go and you slow down the conversion to arachidonic acid. I'll show you how to do that shortly. Notice on the other side of the balance sheet here, we have the fish oil, EPA, that I showed you about. And in fish oil, you also have DHA. It's another omega-3 fat that's important for vision and successful pregnancies and the IQ of the child, for the prevention, we think, of Alzheimer's disease. But notice that ALA can become EPA, and that's a great thing. So ALA is where it's found in flaxseed oil. Some of you are probably taking flaxseed oil. Flaxseed oil is 57% alpha linolenic acid. It's an omega-3 fat. And your body can slowly convert the ALA into EPA. So you get a secondary backup source of EPA by having flaxseed oil. And flaxseed oil seems to have its own independent effects as an omega-3 fat on improving health. Here's our arachidonic acid again. This is like the villain number one. And I said linoleic acid can become arachidonic, but I said that the GLA, it can make this little detour and become prostaglandin series 1, which is also very anti-inflammatory. So by having some GLA oil, which means you're having gamma-linolenic acid from borage seed oil, and with certain vitamins and minerals like antioxidants and vitamin B6 and zinc and magnesium, you actually speed up this pathway to reduce inflammation. The reason it's important is that because as we get older, the body has a hard time making this GLA. So putting GLA in a preformed state from borage seed oil gives your body the GLA it needs to form prostaglandin series 1, which is anti-inflammatory. It's been very helpful, as you're going to see, to make your skin smooth and soft, to combat eczema, to combat arthritic conditions. It's a spectacular prostaglandin series 1, but you have to give your body a chance to make it. So what I'm saying is that there is one omega-6 fat that is a good omega-6 fat, and it's GLA. So let's look at some of the research here to back all of this up. Let's talk about essential fatty acids, heart disease, and cardiovascular conditions. So in 2019, there's this fantastic review, this systemic review and meta-analysis demonstrated that omega-3 fats reduced thromboxane, which makes platelets clump together in an abnormal way, and decreased leukotriene B4, which produces a lot of inflammation. This is true for high-risk cardiovascular patients as well as patients with rheumatoid arthritis, that when you have more omega-3 fats, you have less platelet stickiness and the inflammatory chemicals in the body are much lower. So much so that in the New England Journal of Medicine, they said, you know what? The evidence shows that people with higher blood levels of omega-3 fats, because they consumed it, have much lower risk of cardiac sudden death. That's good to know. One study found that relatively high omega-3 blood levels were associated with a 72 and 81% lower risk of sudden death compared to people whose omega-3 fat index was lower. I'm going to show you the omega-3 fat index in a moment, but higher omega-3 fats circulating in your system and inside your tissue stores strongly linked to less sudden death from cardiac disease. The Mayo Clinic says there can be little doubt that heart muscle omega-3 fats play an important physiologic role in the prevention of life-threatening ventricular arrhythmias, and that high-level omega-3 intake has the potential to benefit vascular health via additional mechanisms. The balance of evidence suggests that an increase in omega-3 intake by the general population would in all probability decrease the incidence of sudden death, heart attack primarily. And in 2014, we see this other study where they said, listen, there are results of a major clinical study involving over 11,000 patients who recently had a heart attack. We gave them 1 gram a day of omega-3 fats. It reduced the occurrence of death, cardiovascular death, and sudden cardiac death by 20, 30, and 45% respectively. It's hard to find drugs that can do that. Further studies indicated a decrease in total mortality and cardiovascular incidents associated with regular consumption of fish and fish oil supplements. I don't know how much more you have to know than that, but there is more to know. And that is that flaxseed oil, not just fish oil, but flaxseed oil shows all these tremendous benefits as well. that flaxseed oil, which is very high in the omega-3 fat called alpha linolenic acid, or ALA, shows tremendous benefit. We see that the higher a person's tissue stores of ALA from flaxseed oil, the lower tends to be their blood pressure. So they said, if that's the case, let's do an intervention study to see if that's really true. So in 2007, they took these really high-risk patients that had heart disease and high LDL cholesterol and low HDL cholesterol, which is the good cholesterol. And they did a 12-week study with 87 male volunteers aged 35 to 70 with these risk factors. And they gave them either safflower seed oil or flaxseed oil. And after 12 weeks, the flaxseed oil group realized a drop in systolic and diastolic blood pressure by 5 millimeters of mercury. No change in the safflower seed group. And this is important because every 2 points that you decrease your blood pressure, it reduces the risk of heart attack by 7% and reduces the risk of stroke by 10%. So a 5-point drop is extremely important in the prevention of heart attack and stroke. So flaxseed oil can do this. It's not all about fish oil. We get caught up in fish and fish oil. Flaxseed oil seems to have its own unique properties that are very preventative, also reducing risk of atrial fibrillation. 9% of people, once they turn 65 years old or older, end up having atrial fibrillation. It's very common. And it's a very difficult problem to treat. And with atrial fibrillation, your risk of having a stroke goes through the roof. So you don't want to develop the problem in the first place. The studies link the intake of ALA with reduced sudden death and non-fatal heart attack. And that's because the alpha linolenic acid in flaxseed oil is extremely preventative and protective. And experimental studies show that it can also help reduce the risk of colon cancer. And that's likely because the flaxseed oil it gets converted eventually to prostaglandin series 3, which slows down the rate at which colon cells are dividing, and that reduces risk of cancer, as I was talking to you about in some of the preamble. So in this study that sort of was looking at all this, they said, over the past 100 to 150 years, the consumption of vegetable oils from corn and safflower seeds, cotton seeds, soybeans has greatly increased, which resulted in drastic imbalance of the essential fats that we have. So today, the ratio of omega-6 to omega-3 fat has shifted to between 20 to 31. The ratio should be closer to 1-to-1 as best as you can get it. And once you get that into the 1-to-1 ratio or close to it, even 3-to-1 wouldn't be bad. Then you start to have really good health outcomes. And so they go on to discuss what I said earlier, that originally humans, our ancestors were eating animals that were foraging for their food, and they had a different omega-3, omega-6 composition in the meat that they were producing. So in 2015, it said a large number of clinical studies have recognized the tremendous potential of omega-3 fats against inflammatory mediators like prostaglandin series 2, keeping that contained, leukotriene B4, keeping that contained, and other inflammatory cytokines that are beyond the scope of this discussion, but they play a big role in cancer and arthritic conditions in particular, and also blood vessel inflammation. All these inflammatory things are going on and behind the scenes that are driving these diseases forward. So omega-3 fats are helpful in the prevention of coronary heart disease, atherosclerosis, and rheumatoid arthritis, and asthma, as you're going to see a little bit later. That was their conclusion in 2015. This is the research papers I was citing on flaxseed oil, if you want to go and read those for yourself. Then we have a thing called the omega-3 fat index and its relationship to blood pressure. So as you eat more omega-3 fats over time, the amount of omega-3 fats in your red blood cell skin, the outer membrane of your red blood cell, starts to slowly increase. And that's something that's easy to measure because you can draw blood and take people's red blood cells out of their veins, and you can actually look at the cell membrane and see what fats are there. So when the fatty composition of the red blood cell membrane is 8% or higher omega-3 fats, you start to get tremendous reduction in blood pressure, both in younger and older people. So younger people today are showing up with the pre-hypertension, or they're showing up with high blood pressure rates we never saw before. And they're saying that in these young people, if they reach that omega-3 fat intake where they get to that 8% index, the chance of that happening is significantly less. And that 8%, having 8% or higher omega-3 fats is linked even in older people to a reduction risk of cardiovascular disease, congestive heart failure, heart attack, and stroke. I mean, the evidence just goes on and on. It's just so obvious what to do. We know that over the course of a month, every 4,000 milligrams of sort of EPA and DHA, omega-3 fats, you get raises your omega-3 index by 0.24%. So over a number of months, most people can get to the 8% threshold. The fish that have the highest omega-3 fat content, salmon, herring, like pickled herring, tuna, bluefish, mackerel, sardines, oysters, and some that have sort of a moderate amount of omega-3 fats. I'm not crazy about eating swordfish because of the mercury content, so you have to watch out in terms of mercury. But here you see the fish here that have omega-3 fat content that can help to bring your omega-3 fat content up. I wouldn't recommend that you have fish more than twice a week because of the risk of too much mercury getting into your system, which can damage your brain and your nervous system. So in our society today, you have to add some supplements in order to get your omega-3 index to where it needs to be. There really isn't any other way to do it safely. But in recent years, the incidence of high blood pressure among young people started to increase, as I said, and part of that is because their omega-3 index is so low that their blood pressure has been rising over time. What about essential fats and arthritis? Well, there's all kinds of unbelievable studies here. One of the hardest arthritic conditions to treat is rheumatoid arthritis, as you can appreciate. So in 2012, there was this review paper. They looked at 10 randomized control studies with these rheumatoid arthritic patients from different studies, all these placebo control studies. And they said that, the individuals who got the omega-3 fats in the studies where they was tested, they ended up over time having fewer tender joints, fewer swollen joints, less morning stiffness, better physical function. They showed improvement in all these parameters. And they're saying for those patients with rheumatoid arthritis, if they're given a dose of omega-3 fats at 2,700 milligrams a day for 3 months or more, they start to get this tremendous effect, and they don't have to use anti-inflammatory drugs nearly to the same degree. That's how much of an anti-inflammatory effect prostaglandin series 3 can have, but you have to give it time to build up in your system to really produce these outcomes. Then we have this study, 12-week study of 49 newly diagnosed patients with rheumatoid arthritis, and they were given some, EPA and DHA, not super high doses, like 3 or 4 thousand milligrams a day. It's not that much. And at the end of the 3-month study, the group that got the omega-3 fats compared to the group that got the placebo, less morning stiffness, fewer tender joints, fewer number of joints that were swollen, their blood inflammatory markers were way down. Doctors noticed a significant improvement objectively. There was no adverse effect on any other things that were going on in their body. There's no risk factors for something serious happening. And they were able to tremendously reduce the number of drugs they had to take. In some cases, they were really able to eliminate all their drugs, which is unbelievable. So these omega-3 fats, if you give them time to work, they really can have an impact. And we're seeing that the EPA and DHA, these omega-3 fats from fish and fish oil, and remember, you can make EPA and DHA from flaxseed oil as well, slowly over time. They not just do they make anti-inflammatory prostaglandins, but they make what are called anti-inflammatory resolvins. So there's other anti-inflammatory chemicals that the body makes from these building blocks, if you will. And omega-6 fats, like arachidonic acid, has the opposite effect. So the conclusion in the 2020 study that was in the Mediterranean Journal of Rheumatology, right? The omega-3 fatty acids are polyunsaturated fats which have an impact on health and disease. They act as building blocks to lipid mediators of inflammation and may attenuate and modulate the autoimmune inflammatory response. What they're saying is this supplementation with omega-3 fats helps to contain the inflammatory process in autoimmune disease, which is really a complete nightmare if you ever end up with an autoimmune condition that's affecting your joints. It's serious business. So anything that can help is magical. Needs to be taken seriously. So imagine what omega-3 fats can do for somebody who doesn't have autoimmune disease, in terms of containing inflammation over time. As you get older, you don't want to have joints that are starting to undergo inflammation, because it leads to degenerative changes. And before you know it, you have chronic pain. Not necessary. And borage seed oil. So I said earlier that GLA from borage seed oil, the body can convert it into prostaglandin series 1. And we have great evidence, even in rheumatoid arthritic patients, if you give them borage seed oil, it also helps their condition. It helps to suppress the production of all these inflammatory chemicals, helps the body make more prostaglandin series 1, which tames the condition. So in 1993, we saw this in the Annals of Internal Medicine. They gave these patients that had rheumatoid arthritis borage seed oil versus cotton seed oil. And they said, oh, it's unbelievable the results we're getting. That group reduced number of tender joints by 36%. Their tender joint score was reduced by 45%, 28% fewer swollen joints. The swollen joint score was much lower versus the placebo. So we see that it's not just fish oil and flaxseed oil, but when you add borage seed oil, you start to double down on the benefits of producing less inflammation, because you need to make prostaglandin series 1, not just prostaglandin series 3. I hope you're following me. Experimental studies also show that omega-3 fats can decrease the development of osteoarthritis in animal models. And that's what this study was really showing. So again, I'll send you these slides. You can go through it. What about essential fats in your brain? Concussion, the prevention of Alzheimer's disease, and all these things that are, especially in an aging population, become critically important. But we'll start with depression, people that end up being diagnosed with depression. Omega-3 fats have been shown to be a fantastic complement to the management of different types of depression, and sometimes are the only treatment that's available to a woman who's depressed or a woman who has postpartum depression. Because if she's breastfeeding, there's certain drugs you just can't give a woman drugs who's pregnant or breastfeeding. I think there are some newly developed drugs that seem to be safer, but for a long time there was no medication for this. Omega-3 fats supplementation has been shown to actually help to improve many cases of depression during pregnancy and postpartum depression, which can have some really horrible consequences. So what are the omega-3 fats doing in the brain to help decrease depression? Well, we see it improves the fluidity of the brain so that there's better communication and neurotransmitters work better, so that you don't end up having this sort of impaired brain communication that we see is linked to depression in many cases. You're also reducing brain inflammation of different types, and so you get a better picture. Is on the surface of all your cells, including your brain cells, they have like little antennas sticking up. You see these little antennas here? Sorry. Those antennas have to receive signals from other parts of the brain as the chemicals come along. And if you don't have fluidity, then they can't pick up the signals. And that seems to be a major feature that occurs in depression. So we have all these studies showing that omega-3 fats have helped. Some of these studies are very small, only 8 or 10 people sometimes, but it leans in the direction to show that fish oil supplementation alone has been very helpful. I would say this: I don't think that a person who has depression should treat it by just using omega-3 fats. I think that's a mistake, because what the studies really show is that the omega-3 fats help antidepressant drugs work better. Sometimes people don't get a complete result from the drugs they're taking. And what we see from the studies is that when you add omega-3 fats, very often things kick in and you get a better outcome. As I said earlier, in pregnant and postpartum depression, sometimes what we think is happening is that as the child is developing, the fetal body is taking a lot of the omega-3 fats from the mother's body through the placenta for brain development. So now the mother becomes depleted in omega-3 fats. And that depletion of omega-3 fats is what sets her up for having depression. So prior to the pregnancy, during the breastfeeding stages, omega-3 fat intake becomes critically important for the development of the brain of the child's brain, as we'll see down the road here a little bit, but also to help guard the mother against having depression along the way. So there are studies to show that this can be very, very meaningful and impactful. Study in 2015 in the Integrative Medicine Research Journal, sort of just showing that oftentimes in depression, the omega-3 fat levels are really, really low. When you give omega-3 fats, people start to bounce back and do better, and their drugs work better. That's really what all this research is leading up to. So let's go down to the bottom line here, because it really sums it up. Omega-3 oil pills are used in combination with serotonin reuptake inhibitors, like Prozac and so on, and are considered as a more standard treatment for depression as recommended by some physicians. And that becomes important to help make mental health drugs work better. You need the brain to have the fluidity and to reduce the inflammatory chemicals so that the drugs can take effect and the person does better. And this is basically this research supporting the same thing, where you have the combination of omega-3 fats with fluvoxamine, standard antidepressant, showing an improvement in the person's symptoms versus either one of them given alone. So you want them to be combined where possible. Same with PTSD. Studies showing that omega-3 fats given to patients that have post-traumatic stress disorder can really help to make a difference. It's decreasing panic attacks and racing heart rates, all these things that become critically important to somebody with PTSD. More and more studies are showing the benefit of giving them omega-3 fats. With respect to Alzheimer's disease, a number of observational studies over the years have shown that that if individuals getting on average is 400 milligrams a day of omega-3 fats, their risk of developing Alzheimer's disease as they get older is significantly less. So the Framingham Heart Study, the Zutphen Elderly Study, other studies have shown the same thing over time. And we think it's because not only is it reducing brain inflammation, improving the fluidity of the brain, increasing blood flow so more nutrients get to the brain cells, but also omega-3 fats also tend to block the production of the dangerous beta amyloid plaque. So here's some of the research on omega-3s and Alzheimer's disease. But the beta amyloid plaque is a key feature here. So normally you have this amyloid precursor protein on the brain cells, which is a normal receptor. But then what happens in Alzheimer's disease is this thing gets chopped off and it forms this plaque, and this plaque generates free radicals that can kill the brain cells. So we see that here's the process. You have this normal receptor, it gets chopped up, and then it coalesces to form this particular beta amyloid plaque. But there's a receptor called the LR11 receptor, and when it's stimulated by DHA, like one of the omega-3 fats from fish and fish oil, it blocks this process from happening. And that's what seems to be really important, is that if you can stimulate the LR11 receptor on the brain cell, then the beta amyloid plaque doesn't form. And that becomes critically important to the prevention of Alzheimer's disease. And we think that's why, omega-3 fats over your lifetime helps to reduce risk of Alzheimer's. So they said in 2015, why don't we test omega-3 fats in some people with mild cognitive impairment and early stage Alzheimer's disease. So they tested it, and they saw that people that have sort of mild cognitive impairment and sort of mild forms of Alzheimer's disease, that when they gave them the omega-3 fats with vitamin D and some antioxidants, that they started to see that some of the beta amyloid plaque was reversing. And they started to see better outcomes in certain patient behavior. Clinical improvement was being seen as part of this intervention. So in mild cognitive impairment, early stage Alzheimer's disease, it might be still possible to turn some of this around. But really, at the end of the day, you want to prevent these problems from happening in the first place, because sometimes it can be too late for these things to even work. 2017 Alzheimer's disease study, again, showing that omega-3 fats improve blood flow through the brain, which affected learning and memory and depression and dementia, was actually improving brain function with the higher the omega-3 fat status. So these are all just things to pay attention to. With respect to essential fatty acids in cancer, a 2021 breakthrough study here that we saw just very recently is showing that DHA, a certain fatty acid in fish and fish oil, omega-3 fat, as it accumulates in cancer cells, can actually cause the cancer cell to commit suicide. But in normal cells, it doesn't do that. So tumor cells seem to have a susceptibility to DHA, which seems to help encourage them to commit suicide or poison them in a way, which we had no idea before was even happening. We do know that people with better omega-3 fat status tend to have a greater, lower risk of certain types of cancer. There's a number of reasons for it, but we just sort of learned that DHA poisoning tumor cells might be one of the other reasons. But I think primarily what happens is that the omega-3 fats form prostaglandin series 3. It slows down the rate at which cells divide. And when that happens, you make fewer genetic mistakes that lead to cancer. So with respect to prostate cancer, because it's the second leading cause of cancer death in men in much of the Western world, there was originally some scare that omega-3 fats were increasing the risk of prostate cancer, but the reality is the evidence shows the opposite. The findings clearly do not incriminate omega-3 fats in prostate cancer. In fact, they're shown to be strongly protective and also decrease prostate cancer mortality. So then, and with respect to patients who already have prostate cancer, when they have fish and more omega-3 fats, their survival tends to be better. So we saw, back in 2001 in the Lancet, a 33% reduction in prostate cancer risk in Swedish men who had more omega-3 fat, higher omega-3 fat status. Animal studies also suggest that omega-3 fats reduce prostate cancer risk. And then the Mayo Clinic also said the preponderance of evidence suggests that higher intake of omega-3 fats decrease risk of prostate cancer, advanced prostate cancer, improve survival in prostate cancer patients who have been treated, and is associated with increased longevity overall. So people just overall live longer if their omega-3 fat status is greater. With respect to breast cancer, we have evidence also to show here in the Breast Cancer Research Journal 2015, high intake ratios of omega-3 fats relative to omega-6 show a reduced risk of breast cancer compared with those that have the opposite profile. More omega-3 fats, less arachidonic acid. Chances are much better that breast cancer is less likely to show up according to this evidence. And there's all kinds of mechanisms through which this works, but I've talked to you, does inflammation slow down the rate at which cells divide? This is how it works. For premenstrual syndrome in women, great 2017 study, because omega-3 fats are going to become prostaglandin series 3, which then reduce inflammation and have a relaxation effect on blood vessels and muscle tissue. A lot of the painful menstruation disappears. A lot of the PMS symptoms of inflammation, breast pain, swelling, bloating, all these inflammatory things, they calm down. So in this study of 95 women who had PMS, we saw that the omega-3 fats produced a fantastic outcome for them. Just in a very short period of time, they were only having 1,000 milligrams a day of fish oil. That wasn't even a high dose. With respect to essential fatty acids in your skin, an essential fatty acid in the skin can actually show up as things that you see quite common on people, these little bumpy lesions on the skin. This can also be vitamin A or a zinc deficiency as well. This dry, rough, bumpy skin, here's another example of it here, and also here. It's not always a deficiency, it can just be genetic, but oftentimes it's an essential fatty acid imbalance. We also see that as skin cells are developing below the surface, they pull omega-3 fats out of the bloodstream. And when there's more omega-3 fats in the skin, not only is the skin usually softer and smoother, but it also helps to protect the skin against ultraviolet light damage that can lead to sunburns and skin cancer. So they have these studies using, it's not just animals now, human volunteers, where they gave them either oleic acid or fish oil. And they're saying, then they exposed their skin to ultraviolet light day after day. And they're saying, we're seeing over time, much less skin damage from the ultraviolet light in the group that's given the omega-3 fats. That was a totally unexpected finding. And the study just goes on. It basically shows that the sunburn reaction, fewer changes in the skin cells that are linked to the development of skin cancer. I mean, that's pretty important because over your lifetime right now, because people live longer, there's a greater chance you'll develop skin cancer than any other type of cancer. Now, there's two skin cancers that are not that lethal, like basal cell carcinoma and squamous cell carcinoma. But if you develop melanoma, that's pretty serious business. So anything that can help to decrease the likelihood of skin cells changing, morphing into cancer cells is important to know about. So omega-3 fats have been shown to help make the skin softer and smoother. Whereas the omega-6 fats, arachidonic acid in particular, making the skin rougher, scalier, and speeding up the rate at which cells divide. That's always risky. That slide is just confirming it. You see the reference there. And then we have, also gamma-linolenic acid, or GLA. So back in the day, they used to use evening primrose oil to get GLA, but now we know that borage seed oil is actually a better choice. But even using evening primrose oil, which is only 9% GLA, whereas borage seed oil is 22% GLA. There's a big difference there. But even using primrose oil, they were able to help improve skin inflammatory conditions like eczema and sort of pruritus, which is sort of itchy, inflamed skin. The feeding of borage seed oil has been shown to actually produce in skin cells these anti-inflammatory chemicals, including prostaglandin series 1, making the skin softer and toning down inflammatory skin conditions. So it's been, it's suggested that people that have eczema, psoriasis, even acne, that these things might actually be helpful. And we'll see some studies in a moment to sort of support that. It's basically saying the same thing. So here we see psoriasis and eczema, right? So in a trial giving them sort of fish oil, EPA and DHA, 13 patients with psoriasis, which is a really difficult skin condition to get a handle on. Because, the treatments for psoriasis until recently have not been very effective. So you have 8 of the 13 people receiving the fish oil showed mild to moderate improvement in their global psoriasis sort of symptoms just in 8 weeks, because you're reducing the inflammatory component. You're slowing down the rate at which skin cells are dividing. That's what psoriasis is. Cells dividing too quickly, and you get this inflammatory effect. And you're taking those inflammatory mediators out of the skin. In people that have eczema, you're seeing also a significant improvement because you're getting the same kind of toning down of the inflammatory response. So it's not just what you put on your skin, it's what you put in your body that makes a big difference to the health and appearance of your skin, And once again, that GLA, because this is the forgotten part of the story here, that GLA from gamma-linolenic acid and borage seed oil, if you can get that to make that conversion to anti-inflammatory prostaglandin series 1 for joint conditions and for skin conditions, that's a big deal. But you need vitamins and minerals to make that happen. So that's why the combination of a high potency multivitamin with borage seed oil, really becomes important. And I'll wrap that up for you at the end. Other studies with psoriasis and eczema showing the effects helping to improve outcomes and producing the types of prostaglandins that are very important for skin texture and to improve these conditions, eczema, psoriasis, druff, and sort of scaly skin. And also flaxseed oil has been shown to improve atopic eczema in animal studies, improving blood flow to the skin and improving more of the prostaglandins to make the skin softer and smoother. So these essential fats help your skin as well. What else do the essential fatty acids do? Well, you need DHA for vision. Laboratory animals with experimentally induced omega-3 deficiency show defects in retinal structure and visual acuity, development, and cognitive performance. So during the development of a child, in utero, enough DHA from the maternal body has to flow across the placenta, not just for brain development, but for normal development of vision and structures of the eye, and again, for brain function, for normal cognitive performance. When it comes to DHA and brain development, the evidence is very, very clear that if a developing fetus doesn't get the DHA that it needs, you're going to end up with cognitive defects, learning disabilities. As you're going to see as well, there's a greater chance of preterm births, which have negative outcomes in many cases. And child ends up having a lower IQ down the road when you test for it. So that DHA is critically important. Also, in the management of diabetes and metabolic syndrome and fatty liver degeneration, omega-3 fats have been shown to be therapeutic in improving outcomes for these patients. It improves insulin sensitivity, so the person doesn't need as much of their diabetic medication if they are diabetic. And in childhood asthma, we see that better omega-3 intake and higher omega-3 status helps to decrease the inflammatory process in the respiratory system, toning down some of the asthmatic reactions and severity. Just incredible stuff. Improved pregnancy outcomes. Here's a study in 2019 showing that during the third trimester of pregnancy, women who have better omega-3 fat status, they have a longer gestational period, so they have full-term pregnancies, better intrauterine growth of the child, and they have fewer preterm births. And that's really important to the outcome of the child. They have 15% lower rates of preterm births. That's critically important. And studies go on and on, basically showing the same thing over and over again. Also, the IQ of the child, when you test them down the road, the IQ at age 5 or 6 or 7 is much higher in a child that got the DHA that it needed from the maternal body during pregnancy and also during lactation. So the mother's DHA status becomes critically important. Here's all the research to support that. Also, in multiple sclerosis prevention, we're seeing nurses who have higher intakes of alpha-linolenic acid found in flaxseed oil, 40% lower risk of developing multiple sclerosis. And then in 2021, I love this study. It just sums up everything that we've been talking about. A 2021 study showed that higher omega-3 fat levels in the body increase life expectancy by almost 5 years. As researchers stated, being a regular smoker takes 4.7 years off your life expectancy on average. The same if you gain or if you have high levels of omega-3 fats. So having better omega-3 fat status gives you this same additional extension of life than having never smoked cigarettes, which is pretty significant advantage to have. The study followed 2,200 people who were over the age of 65, right? So these are already people in the later stages of life. They were monitored for 11 years. The results showed that individuals with higher amounts of omega-3 fats in the outer skin of the red blood cells, that's where you can really measure it to get that index, had improved life expectancy outcomes. So the way that you get more omega-3 fats into your red blood cells is by consuming more omega-3 fats. It's a good mortality predictor. So if they take your red blood cells and they look at it to see what your omega-3 fat index is, if it's not very good, that's a very poor indicator of mortality risk for you. If your omega-3 fat is high in your red blood cells, it means you've got a pretty good chance that your mortality risk is significantly lower. Just that one measurement can mean so much. And then we also see the study in 2013, which is pretty amazing, showing that the group that got omega-3 fats ended up having all these great longevity indicators as well. So as a 4-month study of 106 healthy, sedentary, overweight, middle-aged people who received these omega-3 fats versus the placebo, and they were just following the typical American diet, unfortunately. But the ones that got the omega-3 fats showed less free radical damage or oxidative stress, so less free radical damage destroying their body. And their telomere length increase. So at the end of your DNA strands in your cells, at the tips of your DNA are these telomeres. And when cells divide, the telomeres get shorter and shorter. When it gets to a critical level of shortening, either you're at high risk for cancer or the cell doesn't work very well and you're going to age a lot faster. They're saying the more we improve the omega-3 to omega-6 ratio through supplementation, the telomeres were actually lengthening. The aging was reversing at a cellular level, which is quite remarkable. So they said the data suggests that a lower omega-6 to omega-3 fatty acid ratio can impact cell aging. The triad of inflammation, oxidative stress, which is free radical damage, and immune cell aging represents important pre-disease mechanisms. That means that before you actually get sick, these are the things that are going on behind the curtain that are setting the stage for age-related changes to catch up with you and produce disease. But omega-3 fat intake can, if you increase your status, it can help to reverse some of these effects so you're less prone to it. So let's just wrap up. This is what I'm saying. I'm saying that you need to have a lifetime approach to optimizing your essential fatty acid intake. So the way that you do that is you reduce your intake of arachidonic acid, because that's making prostaglandin series 2, which has those adverse effects. So as best as you can, I'd highly recommend you stay away from beef products and pork products, even chicken legs, which are pretty high in the bad fats. High-fat dairy products. It's any milk or yogurt that's more than 1%. Any cheese that's more than 3%, that's almost every cheese you're ever going to see. Butter, cream, whipped cream, ice cream, cream in your coffee, all those things are loaded with saturated fat, which is inflammatory, and a lot of these things also come with arachidonic acid. So you're better off to use, olive oil, canola oil, peanut oil in place of other types of oils like corn oil, sunflower seed oil, safflower seed oil, those types of oils. You want to minimize those. Reduce your intake of the high animal fats that are full of saturated fat, because they've been shown to drag a lot of endotoxins into the bloodstream and produce a lot of inflammation in the body. And the saturated fat can stimulate receptors on your immune cells that produce a greater inflammatory response. So not only can prostaglandin series 2 produce an inflammatory response that has adverse consequences, but just saturated fat alone can do it. So minimizing those foods is a good idea. And this is sort of just showing you the evidence on saturated fat stimulating the toll-like 4 receptors on macrophages that produce a lot of the inflammatory response. I like the idea of taking every day, as I do, an essential fatty acid supplement that has a high yield fish oil with lots of EPA and DHA, with flaxseed oil and borax seed oil, all sort of wrapped into one capsule. So I formulated this for Adeeva Nutritionals. It's called Adeeva Nature's Essential Oils, because I don't see any other way to maximize the intake of these types of essential fatty acids. And so why would I take this? I take 3 capsules a day. I've done that for 25, 30 years now, to try to reduce joint inflammation and prevent arthritic changes, which for me has been very successful, to prevent cardiovascular problems, inflammation in the blood vessel wall, keep my blood pressure down, prevent arrhythmias, have platelets that are not sticky. For me, it's been a successful campaign. Also to support brain function, all the things that we talked about, fluidity of the brain for memory, to reduce inflammation, Alzheimer's, and cancer prevention, slowing down the rate at which cells divide, keeping your skin texture soft and smooth, and helping to combat UV light. And, if people have eczema, psoriasis, or other skin inflammatory conditions, it could help them as a complementary intervention. Women with PMS, to support vision, as an adjunct to the management of diabetes and metabolic syndrome and fatty liver problems, to reverse the aging process, to give you more longevity, longer telomeres, all the anti-aging things we looked at. Women who are pregnant, critically important. They should talk to their doctor about how to use a product like this. And people that have asthma, to help decrease the inflammatory process in the respiratory passageway. Even children, it can help to tone that down a little bit. Also, you want to reduce your intake or eliminate alcohol, because it can actually propagate the inflammatory cascade by producing more prostaglandin series 2. Hydrogenated fats do the same thing. And to really make prostaglandin series 1 and 3 and maximize them, you need antioxidants like vitamin C and vitamin E and selenium. You need zinc, you need magnesium, you need vitamin B6. So combining that essential fatty acid supplement with a high potency multivitamin, that's the marriage that really maximizes your ability to produce those pathways. So you'll see, if you look at arachidonic acid and you look at all these pathways, you notice that these B vitamins and antioxidants are required for those pathways to work properly. So if you want to convert your omega-3 fats into prostaglandin series 3 or borage seed oil into prostaglandin series 1, you need antioxidants, B vitamins, zinc, magnesium to make that happen. And so I like the idea of a high potency multiple vitamin that gives you those antioxidants at dosages that are going to be meaningful, the B50 complex, the zinc, the magnesium, to help facilitate those metabolic cascades so you can make your prostaglandin series 1 and series 3. And you'll see some of the evidence to support how those vitamins and minerals are important in encouraging the production of these anti-inflammatory prostaglandins. So in the Adeeva all-in-one multiple vitamin, you'll notice that there's 1,000 milligrams of vitamin C and there's 400 IUs of vitamin E, and there's 1,000 IUs of vitamin D in there, by the way. 50 milligrams of all the B vitamins, and there's calcium for your bones, and there's the magnesium, here's the zinc, here's the selenium at 200 micrograms, everything right down to lycopene for the prostate gland and the cervix, lutein for the back of your eyes to help reduce risk of macular degeneration. I really, in that all-in-one multivitamin, I mean, it's called all-in-one because it really saves you having to buy 7 or 8 different bottles of things. People buy vitamin C and they buy vitamin E and then they buy selenium and then they buy B50 complex and they buy calcium and they buy vitamin D. I put it all into one to make it really easy for people to succeed and to make it more affordable. Adeeva made it more affordable. And there's the Nature's Essential Oils that has the fish oil, the flaxseed, and the borage seed oil. And that is really the way that you can, along with the dietary suggestions I've given you, how you can optimize your omega-3 to omega-6 status, keep the bad fats out of the diet, and allow the good fats to be converted more effectively into the health-promoting prostaglandins that have been shown to have all these great effects on different tissues and organs. So that sort of takes us to the end.